I'll start with a rundown of the numbers. As of this morning, there are 15,045 lab-confirmed cases in 99 counties. 464 people are currently hospitalized, and sadly, we have now been up to 550 deaths from COVID-19. As you know, this was the first weekend of phase 1 and the easing of some restrictions in our state. Many people left their homes as a result, whether that was to visit a park or maybe their favorite store that's now open. I know people are eager to get out and resume some of your favorite activities, and the beautiful weather was an added incentive. We've done a great job at keeping the virus low in North Carolina, but we must continue to be vigilant to protect our families and our neighbors. Remember, whenever you leave the house, you want to be doing the 3 W's. Wear, wait, wash. Wear a face mask, face covering, wait 6 feet apart from other people, and wash your hands often. And I want to spend a bit more time on the first W, the wearing of a face covering, and I brought mine with me. I know in my own experience this weekend, I saw a lot of people out, but not a lot of people wearing a face covering, and this was concerning. We want to be in the habit of wearing a face covering, bringing it with us, and covering our faces when we're around other people, because this virus can spread when people have no symptoms, and that's really challenging. It's possible for you to have COVID-19 and not know it, and therefore you could be spreading the virus to others. By covering your face when you go out, you're protecting your friends, you're being a good neighbor and a good community member. Face coverings are also not a substitute for the other 2 W's. Washing your hands and wait 6 feet apart is still really important. We need to do all 3 together to slow the spread of the virus and allow us to continue to progress through all the phases of reopening. We're in this together, and if we can continue to ease restrictions, we know there's going to be more traveling around, but it's going to be really important for us to do those 3 W's in order to prevent the spread of the virus. And while we all need to take precautions to prevent the spread of COVID-19, we also need to take care of ourselves and do all we can to remain healthy. So while you're doing the 3 W's, you also want to stay in close contact with your doctor or other health clinician, and keeping those regularly scheduled appointments, whether that's through telehealth or in person. Don't put off that mammogram or that vaccine visit anymore. Call today, get back on the schedule if you postpone them back in the March or April timeframe. And if you think you need a test for COVID-19, if you're having symptoms, cough or fever, or have been exposed to someone with COVID-19, we want you to get that test, whether or not you have symptoms right now. We realize, though, for those of us who are uninsured, staying healthy and getting the health care you need can be a significant challenge. Increasing access to affordable health insurance coverage is an important way for our state to fight COVID-19. We can help more North Carolinians access affordable health insurance right now by expanding eligibility for Medicaid. This is a tool to get federal support to our communities that 37 other states are using right now. And it's far past time for North Carolina to join them. When folks have insurance coverage, they can proactively manage their diabetes or their high blood pressure or get help to quit smoking. So if they do get COVID-19, they'll be much more likely to recover at home instead of needing a hospital or an ICU to help them get better. Insurance coverage also can allow families in North Carolina to have the peace of mind that knowing if they do get sick, they can pay for the medical care they need. I look forward to working with the General Assembly to bring this federal assistance through Medicaid expansion to North Carolina. And finally, we are adding some additional data that we've been working on to our weekly website. It's an estimated number of patients that have presumed to be recovered from the symptoms of COVID-19. So as of today, we estimate that 9,115 North Carolinians have recovered from COVID-19. To calculate this number, we estimate a median time to recovery to be about 14 days for people who are not hospitalized and 28 days for people who are hospitalized with COVID-19. It's really important to note that this is an estimate. A patient's actual recovery time could be shorter or longer, depending on the severity of illness. This 14 and 28-day interval was chosen based on the World Health Organization's guidance and in consultation with the CDC and other state health departments. The CDC has still not put out their guidance on this, so we may need to update this number if the CDC ultimately decides on a different methodology for calculating this recovery estimate. But for now, you can see it on our website, and it is up there already. So please continue to visit that dashboard to stay informed on the latest COVID-19 updates. And remember, staying home is still the best way to continue to slow the spread of the virus and protect our families and neighbors. If you do go out, remember your 3 W's: wear, wait, and wash. With that, I'll turn it over to Director Mike Sprayberry.
Thank you, Madam Secretary. Good afternoon, everyone. Today is day 63 of the State Emergency Operations Center's COVID-19 response. I'll start today with a bit of non-COVID-19 news. Over the weekend, the White House and FEMA approved a major disaster declaration for 18 North Carolina counties that suffered damages from severe weather back on February 6th. That event included strong winds, tornadoes, floods, and widespread power outages. The combined damage assessments from those counties totaled around $16 million. This declaration will allow local governments to be reimbursed for the cost of responding to and recovering from these storms. As we continue to work to obtain personal protective equipment for the COVID-19 response, teams delivered to 52 counties and 4 healthcare preparedness coalitions ever since Friday. Shipments included masks, gloves, face shields, goggles, head covers, and shoe covers. We're still working on obtaining gowns and expect some shipments of those to arrive this week. Sourcing and procurement continue to be a major priority for the State Emergency Response Team. The mission to support food banks and school nutrition programs also continue. To date, the National Guard has helped distribute more than 870,000 meals for food banks and more than 97,000 meals for schools. These efforts have directly impacted communities in need, and the multi-agency and multi-jurisdictional partnerships to stand up and sustain these operations has been the key to their success. National Guard trucks have also driven more than 70,000 miles delivering meals, personal protective equipment, and essential equipment to healthcare providers. I'd like to echo Dr. Cohen's comments about the importance of wearing face coverings. In addition to medical screening ongoing here, the team working here at the State Emergency Operations Center and in our supporting operations across the state are all wearing face coverings while we work every day. So remember to wear, wait, and wash. That's wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. Guarantee you they'll appreciate it. With kindness and cooperation, we will all get through this together as one team, one mission, and one family. Thank you. And I'll turn it back over to Secretary Cohen for questions and answers. Ma'am, you have the floor.
Thank you, Director. With that, we'll open to your questions. Thank you.
Our first question today is from Andrea Blanford with ABC 11.
Hi, Dr. Cohen. It's Andrea Blanford with ABC 11. Can you clarify what is allowed under the new executive order for groups gathering for worship services? We know a group of state senators is asking specifically about wording in that order that says groups of more than 10 people are allowed to gather outdoors unless it's impossible. So is there any circumstance where a group larger than 10 could worship indoors because it's impossible to meet outdoors? Thanks.
Hi, Andrea. Thanks for that question. And I've heard that concern for the first time earlier today, and we are having a team go back to see if there's any additional clarification that we can give. But let me take a step back of like how did we get here in the first place in terms of the phases and what we're trying to do with protecting our communities and slowing the spread of the virus. What we've tried to do as we think about the first phase of activities, we wanted to move forward with lower risk activities. And as I explained to a group today, essentially the things that are lower risk happen outside, higher risk inside. Lower risk things are things where you can be walking around. Higher risk are when you're sitting or you're sedentary or in one place for a long time. So the highest risk things are when you are indoors and sitting, and the lower risk things are when you're outdoors and walking. So you can see why in the first phase of things, we wanted to move forward with activities that allowed you to do the lower risk things that are outdoors and walking, like going to a park. I did that this weekend with my family. Or to go to somewhere, if you have to go indoors, where you're actually walking around. So somewhere like a retail establishment, or a store, a clothing store, or what have you. So those are the activities. So we wanted to focus on those lower risk activities. The higher risk activities are the ones, like I said, indoors and sitting down. And as you can imagine, worship services fall into that higher risk category. Doesn't mean that we can't ever get there. It just means that if we want to slowly phase in terms of risk, that one is one we wanted to put off until a later time. When we do move indoors, we always want folks to be doing the 3 W's for sure. Because when you go indoors, a couple of things are happening. One, the airflow is not as good. Second, you are touching more surfaces by nature. You're going indoors, you're touching doorknobs, you're having shared facilities and bathrooms and other things. You're touching the books, the pews, etc. And then the third part is that you tend to be more close together because it's an indoor space rather than outdoor where you have potentially more space to move around, right? So those are all the factors that we want to think about. So as people think about needing to do indoor activities that are at higher risk, we want them to think about those things, right? Where airflow. So we want to have folks really thinking about airflow as they think about indoor activities for larger groups of people. They want to think about those surfaces that people touch a lot, right? So that goes to the deep cleaning. And then we want to be focused on spacing. Spacing is going to be really critical, which means you're not going to be able to fill capacity in any of these places. So I go through all of that explanation because I keep hearing that not just in worship, but in other circumstances. So I wanted to go through so that we do have a way of trying to address this, that we're trying to help folks do the things that will keep us all protected, will keep the viral spread low. As far as the worship services, they fall into a particular category with special legal status. We don't want to interrupt anyone's ability to worship, to pray, but we want to keep folks safe. That's why we're trying to find this middle ground. We're hoping as many people can heed our advice and say, look, can you have your church services outdoors? But even when you're outdoors, please stay 6 feet apart. Please wear face coverings. Please wash your hands. But there are extenuating circumstances as in everything in life. If you need to come indoors, we want you to stay below 10 people. Can you use online streaming to do worship services? Can you stagger? Can you go into multiple rooms so that folks aren't in the same physical place, again, so that there's different air movement, different surfaces that people are touching? Those are the kinds of things that we're trying to ask people to do. Again, to be as protective as we possibly can and to keep viral spread as low as we possibly can. I hear you, Andrea, in this question, we heard it from a number of stakeholders about this word. What does it mean if it's impossible to go inside? What does that mean? So we're taking that back to our lawyers. I think this is more of a legal definition of what can we do to give folks some more clarity around that piece. So we hear that feedback and we'll try to give more clarity. But I'm hoping this is a very long answer, sorry. I hope this will just give you some thinking about how folks can protect each other and the faith communities will go forward. I know the faith community's done an incredible job of wanting to keep their congregations congregations safe, and I'm so appreciative of their partnership as we work through these unprecedented and times where there really is no blueprint. But we do have science to guide us. We're going to try to rely on that as much as possible and use the data to guide us to keep folks protected, and we'll keep doing that as we move through this. All right. Thank you for tolerating a long answer on that one.
Our next question is from Brian Murphy with the News and Observer and the Charlotte Observer.
Hi, Dr. Cohen, you mentioned last week that anyone who needs a test can get a test. I wondered if you could explain that a little bit more. What is the definition of need in this case? And I've seen your April 20th guidance. Does it still fit under those categories, or have you been able to expand who should be able to get a test at this point?
Yes, sorry, need, I guess, is in the eyes of the beholder. But the way we are defining anyone who needs a test, absolutely anyone with symptoms, anyone who has a cough or a fever, if they have loss of smell or taste, certainly all of those folks, anyone who's having symptoms should be getting a test. Then anyone who's had an exposure to COVID-19 should be getting tested as well, whether or not you have symptoms. So if you have symptoms, absolutely get the test. But even if you don't have symptoms, we want folks to be getting tested if you've gotten exposed. It doesn't have to be immediate, but we want you to get tested in a certain window of time so that if you are positive, again, we know your contacts and such. So our definition is anyone with symptoms and anyone who's been exposed, and that could be a wide variety of folks. We know at some of our federal sites, at some of our Walgreens, our Walmart, our Harris Teeter sites, you do not need a physician referral to those sites. You can self-refer saying, I'm not feeling well, or I think I've been exposed, I need a test. So all of those do not need a physician referral. Obviously within a physician office and such, they will do more clinical evaluation on the front end and use their clinical judgment about testing or not. But we want anyone with a symptom or anyone who's been exposed in some way to COVID-19 to get a test. It's important. We've been really working on our lab capacity. We have the capacity here in North Carolina. We now just need folks to know that the guidance has changed, so if you need the test, get it. Look forward this week to, we want to put actually on our website all of the various places you can go get a test across North Carolina. There's a lot. And so we want to make sure everyone knows what's available in their community, so stay tuned for more of that as well, Brian. Thank you.
Our next question is from Victoria Bouillabaisse with Enlace Latino NC.
Hi, thank you so much. My question is, will your department be doing anything to address the increasing number of COVID-19 cases among workers in poultry processing and meatpacking plants? And then a follow-up to that would be, will you release the names of these plants, and would you require that the facilities with outbreaks release their numbers?
Thanks for that question. We've been talking about that for a number of weeks on the work that we've been doing in this space, and I'll have Director Sprayberry talk about it because it is a public health effort, but it is frankly a multi-agency effort, ag, emergency response, the Department of Public Health, Division of Public Health within my department and others. But, essentially there's a number of things that are going on to make sure that we are getting a handle on these. As you know, the meat and poultry plants are critical infrastructure businesses. They are regulated by the Department of Agriculture. They have been deemed by the President of the United States to need to be open. But we know in order for them to be open, their workers need to be within 6 feet. And as we've been talking, that puts you at higher risk for spreading the virus. So there are things that we can do, and we have been offering that assistance to these companies to make sure they are protecting their workers. Things like putting on face masks, not just coverings, but having PPE, personal protective equipment like we would have in a healthcare setting, have that available for their workers, have barriers, have testing on site, making sure sure if someone is sick that they can get paid sick leave and be home. But we have to understand that the meat processing plants are also different from a nursing home, say, where we know the folks who live in a nursing home do not leave that space. The workers, they do go home. They go home to their communities. So we have to be working at the plant, and we have to be working in the communities to make sure that we are working to slow the spread of the virus. And so with that, I don't know, Director Spraber, anything you'd like to add to that?
I would just say that, Madam Secretary, you hit most of the big parts. I think it's also important to note that we have been working very closely with these processing plants with multi-agency teams that include the Department of Agriculture, who regulate these plants, the Department of Health and Human Services, the Department of Labor, and also CDC. We've also had National Guard out there working to help us do some testing. So it's been a whole of government approach to assisting with making sure the people that are working in these plants are safe, and we want it to make sure that they're getting safer all the time. So we're working really hard to do the best that we can.
Great. Thank you.
Our next question is from Kate Martin.
Hi, Dr. Cohen. This is Kate Martin with Carolina Public Press. I'd like to follow up on the previous question. You had mentioned that you're encouraging the workers for the meat processing plants to get paid sick leave. Are they able to get paid sick leave? Is DHHS getting the results of these tests? And you had said last week that you were considering, I can't remember your exact wording, but I think a number of us interpreted it as you considering releasing the names of these plants. Where are you on doing that? Thank you.
Great. Thanks, Kate. You know, there are quite a number of companies here. At the beginning of this, I talked to a number of them myself personally, so I'm not as close to some of the newer details. But in all of the companies that I spoke to, yes, paid sick leave was part of their strategies here. And so, but I can't speak to it being every single one, but we can follow up. And yes, in terms of sharing information, we've always said we want to share information. We want that to be accurate. As you know, that this is not an industry regulated by the Department of Health and Human Services. We want to make sure we're getting all of the information that we need in order to put that back out to you in an accurate way. In the meantime, obviously, we have already released testing lab data by zip code, and folks know where plants are across North Carolina. So that's a good start in terms of information that is out there right now. And again, we want to know both about what's happening at the plant, but also about the community, because we know these folks that are working there and then are in their community as well. So we have to make sure we're paying attention to both, which we are. And so I think the zip code level data gives you some good information to start with. But yes, we hear you in wanting more information about names, but again, because we don't regulate these industries, getting a full and clear, accurate picture of this is something we're still getting our arms around, but we hope to be able to share something soon.
Next question is from Rose Hogan with NC Health News.
Rose, I can't hear you.
Let's go ahead.
Okay, Rose. Yes.
Let's go ahead to Chandler Morgan. Oh, go ahead, Rose.
I'm interested to know more. Hello? Can you hear me?
Go ahead, I can hear you.
Okay. I'm interested to know more about the numbers for the recovery numbers. You know, you've said that it's 14 days and 28 days, but you know, what about people who have long-term injuries from their illnesses? You know, how are you dealing with some of the squishiness of this number?
Yeah, this has been a hard, thanks Rose for the question in terms of recovery numbers. That's why we're being very clear. This is an estimate. That means some people are going to have a much longer tail to this. Those people who have longer tails to the illness tend to be those who needed hospitalizations, which is why we have said 28 days for anyone hospitalized, 14 days for non-hospitalized. And again, I think you're exactly right. Some are going to be longer, some will be shorter. Felt like 14 days was right, but everyone should just take that as an estimate. We're trying to give people the best sense we can. We looked at some information from the World Health Organization, worked with the CDC on this, and as we said, we were hoping the CDC would give us more official guidance on this. Rose, to your exact point, with all of this nuance in there, is there more we should be accounting for? Doesn't look like they are going to be giving that guidance, and so we know this has been something folks have been asking for quite a number of weeks, and so this is our best attempt at it, given as you said, the squishiness of these things. That's why it's an estimate. And give folks some sense of what's happening here in North Carolina. If there's new information that we get, we may have to change the way we calculate this, but at least we tried to give folks a picture of what this number really means at this point, and that it could change in the future if we see other information that we learn about this virus or to get different guidance from the CDC.
We'll take our final question from Chandler Morgan at WBTV.
Hi there, this is Chandler Morgan from WBTV. My question is actually pretty similar along the lines of Rose's, but with just one differentiation, which is about the interest that people have really had in reporting active cases versus just positive cases moving forward. Is there any information you can give us about what's being looked at for your department as for further reporting the big picture of recovery?
Thanks, Chandler. So I think this was a first step today on putting the numbers out related to recovery. And again, some of this, we need to always get more information as we go here. Obviously, we need to know if someone's been hospitalized in their course of their illness, and obviously that changes the math. So I think this was our first step at trying to give folks our best estimate here based on what we know about the virus and about recovery times in various populations. So I think this is a first installment. I'm happy to take back to the team some more information about how do we capture and depict back to folks active cases here in North Carolina. But right now we have total number of cases, we have recovered cases that we do estimate, and we'll continue to put as much information on our website as we can to give everyone an accurate picture of what's going on in North Carolina. We do hope to continue to learn more about this virus as we work with our research community, as we learn from other states and other countries as we move through this. So always stay tuned for more, and there's always more updates as we go. So with that, I really appreciate everyone from tuning in. Again, wear your face covering, wash your hands, wait 6 feet apart, and just appreciate everything everyone is doing to slow the spread of this virus as we move through phase 1. Thank you so much.